Welcome to our educational series on orthopedic surgery. Today, we'll explore total hip replacement, a common and effective solution for severe hip pain and disability. Total hip replacement, also known as hip arthroplasty, is a surgical procedure where a damaged hip joint is replaced with artificial components. It's typically recommended for patients with severe hip pain and dysfunction. Several conditions can lead to the need for a hip replacement, including osteoarthritis, rheumatoid arthritis, traumatic arthritis, and avascular necrosis. Osteoarthritis is the most common cause, characterized by the wear and tear of the joint cartilage. Rheumatoid arthritis is an autoimmune disease causing inflammation in the joint. Traumatic arthritis results from an injury, and avascular necrosis occurs when blood supply to the femoral head is disrupted. Common symptoms that may indicate the need for a hip replacement include persistent pain, stiffness, difficulty walking, and reduced range of motion. These symptoms can significantly impact daily activities and overall quality of life.
Pre-operative preparation, medical evaluation. The patient undergoes a thorough medical evaluation to assess overall health and suitability for surgery.
X-rays and possibly other imaging tests are done to evaluate the extent of joint damage. The patient receives information about the procedure, expected outcomes, and post-operative care. Surgical procedure anesthesia. The patient is administered either general anesthesia, unconscious throughout the procedure, or spinal epidural anesthesia, numbing below the waist. The surgeon makes an incision on the side or front of the hip, exposing the hip joint. Hip joint exposure. The surgeon dislocates the femoral head, ball-shaped top of the femur from the acetabulum socket in the pelvis. Femoral head removal. The femoral head is removed from the femur, thigh bone. Preparing the femur, the surgeon hollows out the femur to fit the prosthetic stem. Component placement. The femoral head component, typically made of metal or ceramic, is placed on the femoral stem. A spacer made of plastic, ceramic, or metal may be inserted between the femoral head and acetabular component to create a smooth gliding surface. Joint stability. The surgeon checks the stability and range of motion of the new joint. Post-operative care recovery room. The patient is monitored closely in a recovery room immediately after surgery. After surgery, patients undergo a structured rehabilitation program to restore movement and strength in the hip joint. Early mobilization, physical therapy, and pain management are crucial for a successful recovery. Total hip replacement is a highly effective procedure that can greatly improve the quality of life for those suffering from severe hip pain. If you have any concerns or symptoms, consult with your orthopedic specialist.